Bell, Bill Berryhill, Tom Berryhill, Blakesley, Block, Blumenfield, Bradford, Brownlee, Buchanan, Caballero, Calderon, Carter, Chesbro, Conway, Cook, Cotto, Davis, De La Torre, De Leon, DeVore, Ing, Evans, Fior, Fletcher, Fong, Fuentes, Fuller, Furutani, Gaines, Galgiani, Garrick, Gatto, Gilmore, Hagman, Hall, Harkey, Hayashi, Hernandez, Hill, Huber, Huffman, Jeffries, Jones, Knight, Blue, Logue, Lowenthal, Ma, Mendoza, Miller, Monning, Nava, Nastande, Nilo, Nilsson, Norby, V. Manuel Perez, Portantino, Ruskin, Solis, Saldana, Silva, Skinner, Smythe, Solorio, Strickland, Swanson, Torlixon, Torres, Tarico, Tran, the Lions, Yamada, Mr. Speaker.
A quorum is present. We ask our guests and visitors in the rear of the chamber and the gallery to please stand for the prayer. We ask our Assembly Chaplain, Father Constantine Papadimos, to offer the day's prayer.
Good morning. Let us pray. Lord, one of our human tendencies is to tuck away things in tidy little compartments. We call one thing sacred and another secular. But the fact is that anything touched by your presence has upon it sacred significance. Help us to live our lives always conscious of your abiding presence, so that even the most mundane objects or activities can assume enormous significance in our life. Lord, when you are part of everything we do becomes holy. Amen.
We ask our guests to continue standing for the pledge, and we ask Assembly Member Gilmore to lead us in the pledge. You may be seated. Reading of the previous day's journal.
Assembly Chamber, Sacramento, Wednesday, June 16, 2010. The Assembly met, and I am Honorable Fiona Ma, Speaker Pro Tem of the Assembly presiding. Chief Clerk E. Dawson Wilson at the desk. Assistant Clerk Timothy Moreland reading. The roll was called. Adams, Amiano, Anderson, Arambula, Bass, Bill Berryhill, Blakesley, Block, Blumenfield, Bradford,
Mr. Calderon moves and Mr. Hagman seconds that the reading of the previous day's journal be dispensed with. Presentations of petitions, there are none. Introduction and reference of bills will be deferred. Reports of committees will be deemed read and amendments deemed adopted. Messages from the Governor, there are none. Messages from the Senate, there are none. Motions and resolutions. The absences for the day will be deemed read and printed in the journal. Mr. Calderon.
Yes, Madam Speaker, I request unanimous consent for Assembly Members Anderson, Hayashi to have guests at their desks and a photographer on the floor.
Without objection.
Also, I want to advise you that there is an introduction that Mr. Silva would like to make in terms of a guest that arrived today that's in the back of chambers.
Without objection.
Also, request unanimous consent to allow Assembly Member Logue to speak on Adjourn in Memory today.
Without objection.
Committee to committee referrals. Request unanimous consent to refer bills to committee per Assembly Rule 96. SB 1285 Steinberg from Judiciary Committee to the Rules Committee.
Without objection.
SB 947 by Wiggins from the Veteran Affairs Committee to the Rules Committee.
Without objection.
File notice waivers. I request unanimous consent to suspend Assembly Rule 56 so the Agriculture Committee can notice SB, looks like SB 11. This has SB 11,177, but I assume it's SB 1177 by Ms. Kehoe for hearing on Wednesday, June 30, 2010 at 1:30 p.m. in room 126, pending re-referral from the Natural Resources Committee.
Without objection.
Request unanimous consent to suspend Assembly Rule 56 so the Transportation Committee can notice SB 1341 by Senator Price and SB 1445 by DeSaulnier for hearing on Monday, June 28, 2010 at 1:30 p.m. in room 4202 pending referral from the Local Government Committee.
Without objection.
And also, I'll split the issue. Also, I request unanimous consent to waive the file notice requirement to allow Appropriations Committee to meet and hear SB 227 by Alquist and SB 895 by Huff today upon adjournment of session in the Rules Committee room upon call of the chair.
Without objection.
And I request unanimous consent to waive the file notice requirement to allow Appropriations Committee to meet and hear AB 2492 by Mr. Amiano.
Mr. Hagman.
Thank you, Madam Speaker. We do object to this. We request a roll call vote.
Mr. Calderon moves, seconded by Ms. Evans, to have a roll call on this file notice requirement. The motion takes 41 votes. Mr. Calderon requests an aye vote. Mr. Hagman requests a no vote. Clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. Mr. Calderon asks for an aye vote. Mr. Hagman asks for a no vote on the motion. Mr. Calderon moves the call.
Yes. Items from the enacted file. Notice of intent. At the request of the author, give 1 day notice of intent to remove from the inactive file. Did I say that? If I didn't, from the inactive file, 1 day notice to remove an item. That's file item A21 SB 797 by Pavley. Request made by Mr. Bradford.
Clerk will note 1 day notice.
From consent, at the request of the author, please remove file item 73 ACR 171 by Mr. Gaines from the consent calendar.
Clerk will note.
Also, remove file item 65 SB 1330 by the Senate Judiciary Committee at the request of the author from the consent calendar.
Clerk will note.
And finally, Madam Speaker, I move to suspend Joint Rules 29.5B and 30.7 to allow the Committee on Conference on the Budget Committee, AB 190, to continue to meet until midnight, Tuesday, June 29, 2010, an additional 10 days beyond the original date to submit a conference report.
This measure requires a roll call vote. 54 votes is needed, members. Clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. Mr. Calderon and Mr. Hagman request an aye vote on this motion, members. Mr. Calderon moves the call.
Madam Speaker,
Yes, Mr. Calderon.
one final matter. With respect to file item 73 ACR 171 by Mr. Gaines, we removed it from the consent calendar, but I'm now asking unanimous consent to allow Mr. Gaines to take the measure up without reference to file for purpose of third reading today.
Without objection. Okay, members, we have a few guests here today. Mr. Silva.
Thank you, Madam Speaker. One of the many pleasures that I get out of being in the State Assembly and walking around the Capitol is seeing young people tour the Capitol, knowing that one day many of these children will end up being in the seats that we now occupy. This is a time of year when we have graduation, and I am very proud to introduce one of my dear friends who just graduated from 6th grade. She's in the back of the room. I'd like you to give her a big smile. Alexa Borg. Thank you, Madam Speaker.
We'd also like members to focus their attention on the rear of the chamber as we welcome the Dairy Farm Leaders program, Joanne Durrat from John and Joanne Durrat Dairy in Oakdale, Brian Fiscalini from Fiscalini Farms in Modesto, Tessa Curti Hall, Western United Dairymen in Visalia, Travis Camper, Mount Whitney Dairy, Riverdale, Brian Toledo, Toledo Dairy in Galtz, Vonda Van Vliet's, Creekside Dairy, Escalon, Travis Visser, Garrett Visser and Sons Dairy in Riverdale, and Stephen Westine Dairy in Linden. And Mr. Tom Berryhill will officially recognize them. Mr. Berryhill.
Yes, thank you, Madam Speaker. Members, this is a bunch of leaders from the Dairy Ag Leadership Team. They are both today's leaders and tomorrow's leaders. They're up here visiting both yesterday and today. And just a little bit of information about their industry and what they represent. Dairy is the number 1 leading dairy production state or California is in the nation, surpassing Wisconsin in 1993, and produces 39.5 billion pounds of milk. It is ranked first in the U.S. in the production of total milk, ice cream, yogurt, non-fat dry milk, and whey protein concentrate in the country. But most important, members, and I think this is important to remember, California's dairy business generated $63 billion in economic activity and represents 443,000 full-time jobs in the state of California. So, members, I'd like to give you a warm welcome for these kids and leaders in the dairy industry. Thanks for coming.
We're ready to take up business on the daily file. Second reading, the clerk will read.
Senate Bill 1348 with amendments, 1058 with amendments, and Senate Bill 1003.
All bills will be deemed read and amendments deemed adopted. We're going to start with concurrence item number 4, AB 139. Clerk will read.
Assembly Bill 139 by Assemblymember Brownlee, an act relating to local government.
Ms. Brownlee.
Thank you, Madam Speaker and members. AB 139 is back for concurrence. Amendments taken in the Senate simply clarify the public notification process if county boards of supervisors move to hold a regular meeting outside of the county seat. This bill will make local government more accessible to all residents within a county and has received unanimous bipartisan support thus far. I respectfully ask for your aye vote.
Seeing no further questions or debate, clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll, tally the votes. Ayes 52, no 0. Measure passes. File item 5, AB 1374. Clerk will read.
Assembly Bill 1374 by Assemblymember Brownlee, an act relating to adult education.
Ms. Brownlee.
Yes, thank you, Madam Speaker and members. AB 1374 implements technical and substantive changes to the adult education teaching credential based on the Commission of Teacher Credentialing Advisory Panel recommendations. The Senate amendments clarify that the measure does not change the requirements for existing adult education teachers. This bill, again, has received unanimous support throughout the process, and I ask for your aye vote to concur in the Senate amendments.
Seeing no further questions or debate, clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll, tally the votes. Ayes 59, no 0. Measure passes. File item 19, SB 726. Clerk will read.
Senate Bill 726 by Senator Ashburn, an act relating to medicine.
Mr. Swanson.
Madam Speaker and colleagues, I carried a similar bill to this one that passed this House last year, and now I am being a floor jockey for Senator Ashburn on his bill, SB 726. This deals with access to health care. Today, California faces a health crisis, as we all know. The severe shortage of doctors who are willing to treat Medi-Cal patients and to establish medical practice in communities with large Medi-Cal populations. More than 3 million Californians cannot get medical care because they rely on Medi-Cal for their health care. The recession has exacerbated this problem, and with the implementation of the federal health care reform, it will increase the number of Medi-Cal recipients to over 5 million Californians. The maldistribution of physicians in rural and inner-city urban areas has been a problem for decades. The attempt to address this issue, including loan forgiveness programs for doctors who work in these areas, have not worked. Doctors are still refusing to see Medi-Cal patients, limiting the number of Medi-Cal patients they see, or simply not setting up practices in these areas. A person should not have to drive 90 miles away from their home just to see a doctor or for medical care for their children. A person should not have to seek out care in the emergency room because they have no access to a physician. This is what we're talking about, access to a doctor. Access is a problem. Reimbursement rates are a problem for sure for many physicians. I wish we would do something about that. While we do not have the means to increase the state reimbursement rate at this time for doctors, we do have the ability to address this issue of access this year by passing SB 726. SB 726 and my bill, AB 646, which passed off the floor in May of last year, would allow public health care districts and rural hospitals in medically underserved areas to directly employ doctors and pay competitive salaries to provide care to Medi-Cal patients. This bill is a modest step. This bill is a modest step to addressing a growing health care crisis facing California, and it wouldn't cost the state a dime. The opposition has made a number of assertions about this proposal, as well as the Assembly bill that addresses the issue of physician hiring. They have said that this bill allows hospital administrators to interfere in medical decisions made by employed doctors. This is simply false. Doing so is a violation of the Medical Practice Act, punishable as a felony. They have said that this bill would eliminate the bar on the corporate practice of medicine. This is not true either. SB 726 is a pilot program that only applies to healthcare districts and certain rural hospitals, so it is limited in scope. The bill has the support of more than 60 organizations statewide, including the Medical Board of California, the California Farm Bureau of California, Association of Counties, Equality California, and Catholic Healthcare West. SB 726, AB 646, and AB 648 are the only proposals that will deliver doctors and expand access to health care for the medically underserved Californians. No one is competing for the Medi-Cal population business. It is time for us to stand up for these patients and for the doctors who want to work in these areas but cannot afford to do so, and you can afford to allow that to happen by supporting this measure, and I encourage your aye vote.
Mr. Nastande. Ms. Harkey.
Thank you, Madam Chair and members. I rise in opposition to this bill. There is nothing more harmful to our medical service that we don't have providers. Providers are doctors. And doctors should work for patients, not for corporations. That's a fundamental in medicine. You want your doctor working for you. And so while I appreciate that there are underserved areas, I cannot imagine there will be more served areas by impacting doctors from practicing medicine as they see fit. They have a right to be working for themselves. They want to work for themselves so that they can make decisions on life and death for themselves and not on the basic cost of what's happening. All of us know that we have problems in our healthcare system, and all of us know there are underserved areas. But there are also programs where new doctors can, in fact, get their medical their medical education, so to speak, reimbursed to go to these areas to serve. So there are incentives, and I think we need to provide incentives to serve, not place doctors under a corporation. That's not where they belong. They are private practitioners. They should be allowed to make their own decisions based on their own judgment, not on the cost of what some treatment is going to provide. Thank you very much.
Ms. Strickland.
Thank you, Madam Speaker. Members, I rise in strong support of SB 726. This issue is really important in my district, very critical to the healthcare district so that they can provide quality medical care for the people of rural communities. It will provide much needed access. It will also improve the quality of care provided in our communities and incentivize doctors and specialists to be able to come to underserved rural communities. With all of the tax and regulatory burdens, it's very difficult for California to compete for the doctors that we need, and that competition is about to get more intense as federal health care reform is put in place. We're going to be left in the dust as California medical school graduates leave the state to look for jobs other places, and I believe this is a great way to keep our talent local and to make sure that we have appropriate access and quality care for California residents. Thank you.
Mr. Chesbro.
Thank you, Madam Speaker. I rise in support of SB 726 as a principal co-author. This bill is an important tool to help address the long-standing and increasingly severe shortage of physicians that exists in underserved areas, including rural California and most especially in my assembly district. In 2003, I authored SB 376, which created a limited pilot program to allow district hospitals to employ 20 physicians statewide. This pilot was considered a success by hospitals and doctors that qualified to participate, but will sunset in 2011. As you know, I'm authoring AB 648 to expand the pilot program to rural hospitals in underserved areas. Unfortunately, my bill has been currently stalled, like Mr. Swanson's bill in Senate B&P Committee. SB 726 will address the issue of access to physicians in underserved communities, including rural California. Physicians are unable to financially survive in rural areas, given the high percentage of patients who are either insured by Medi-Cal or Medicare or are entirely uninsured. An additional barrier to attracting physicians to these areas is the geographic isolation of these rural areas. Another concern that I know will be raised during this discussion I'd like to respond to in advance is that the potentially hospitals will be robbing Peter to pay Paul by recruiting physicians away from community clinics. And specific provisions have been put in Mr. Ashburn's bill and are also in my bill to prevent that. I won't cite the exact portion of the bill, except to tell you that the chief executive officer of either a hospital or the hospital district must certify that the hospital did not actively recruit a physician or surgeon who at the time was employed by a federally qualified health center or a rural health center. I'll be happy to show that to any of you who'd like to see it. I'm supporting this bill because by allowing certain hospitals to hire physicians, it will provide those physicians with a level of financial security they cannot otherwise achieve in rural and other underserved communities. I would urge your aye vote.
Mr. Arambula.
Thank you, Madam Speaker. I regretfully rise in opposition to the bill. If this was a pilot, I would support it because I do think there may be some merit for some parts of the state. But one of the drawbacks of passing legislation that affects the entire state is that there may be some inadvertent consequences. In my particular area, I have a grave concern that federally qualified health clinics will be impacted. They have come to me expressing a great deal of concern. And one example is that there is a young boy in the city of Firebaugh who had asthma. He could have been dealt with at the, if there was a health clinic there, for $40 for an inhaler. Instead, his family had to drive an hour to a hospital, incur a $4,000 bill for the lack of available preventative care. And I'm concerned that this bill simply would rob Peter to pay Paul. A lot of the constituents that I have are served by health clinics. And if hospitals are able to provide permanent employment, there won't be an increase in the number of medical providers. There will be a shift from clinics to the hospitals. And I would rather focus on establishing a new medical institution to produce more doctors or to increase the rates. But this bill simply shifts from qualified health clinics that are already providing the bulk of medical care to hospitals. And I think that that would be adverse to the severe shortage of doctors in certain parts of the state, including the Central Valley. So for that reason, I regretfully oppose.
Mr. Monning.
Thank you, Madam Chair, members. I also stand regrettably in opposition. Great respect for the author, and I think we all share in the objectives of this legislation. The goal is to bring more doctors into underserved areas in the state of California. Since this bill was initiated and introduced, the national health care reform led by President Obama that California is now in the position of trying to implement bases the expansion of health care access to Californians on a medical home basis, establishing a medical home in primary care facilities, clinic-based. The federal reform will provide federal money to support rural clinics in underserved areas of the state of California. While this bill, the Ashburn bill, does have a provision that arguably would stop recruitment by hospitals away from clinics, it does not protect in the recruitment of a limited number of primary care physicians into underserved areas. My belief and my concern is that we need to prioritize bringing primary care doctors into rural clinics, into underserved community clinics as the best locus for providing preventive care, for providing culturally sensitive care, language-appropriate care. Remember, friends, hospitals are places where people go who have illness, who need emergency services in an ER, or who have an illness. We need to bring down health care costs and to bring doctors in contact with the people who need the service in their communities, to advance preventive care, to advance education, promoting good health. We need to not put a barrier for clinics that receive often less funding and have smaller budgets than urban-based hospitals. We can't take away their ability to recruit primary care physicians, to establish a medical home system that we have the opportunity now to promote.
So I look forward, if there's prospects for working on this with the author in the future, to doing that. I do applaud the efforts of all who share the commitment of expanding health care access to the underserved. But at this point, I stand in opposition, would ask for a no vote. Thank you.
Mr. Jones.
Members, I rise in support of this measure, and I think for those who think that this measure is somehow going to end the world as we know it, we need to remind you of a few things. First, we already, Madam Speaker, could I have order in the House? We already allow direct hire in a host of circumstances. We allow it for medical schools, we allow it for clinics, we allow it for Knox-Keene health care service plans. This bill and the Swanson bill and the Chesbro bills narrowly expand that to underserved areas where everything else we've tried to get physicians into those areas has not worked. Has not worked. This gives us a modest opportunity to begin to get physicians into these areas where everything else we've tried has not worked. Now, we could wait, as was suggested a moment ago, for national health care reform to be implemented. But in the meantime, the House is burning down in the districts represented by Mr. Chesbro and Mr. Swanson, by many of us also on this floor. Number one. Number two, I'd encourage you to read the bill. Because if you read the bill, you'll see that there is explicit language in the bill that precludes and prohibits the hiring of physicians under this pilot project who are currently employed by the federally qualified health centers that Mr. Arambula has pointed to and Mr. Monning has pointed to. And I will submit as well that the author of this bill is willing to take additional language to prevent supplanting in this circumstance if the opposition would negotiate. Now, I want to remind members of something else as well. The Health Committee had a very, very extensive discussion of this bill last year. And we had a bipartisan vote. 15 members of the Health Committee voted to support this bill last year. And those of you on the committee then will remember that this was one of the most extensive and workshopped bills that I've ever seen in my experience here in the legislature. We had a roundtable discussion about the bill, Republicans and Democrats chiming in, and we had bipartisan, strong bipartisan support for the bill with amendments we took in the committee to further narrow it, and we sent the bill back to this floor. Now, this bill is consistent with two prior bills that this House has voted on, Mr. Chesbro's bill and Mr. Swanson's bill. Why is it important that we pass this bill? Because if we don't, the California Medical Association, which is opposed to the bill, won't negotiate. And I will tell you, as the chair last year, I invited all the stakeholders to come in and negotiate to see if there were things we could do to the bill to improve the bill from the perspective of those who are opposed. And the California Medical Association declined to come to the table. And there have been efforts since then to ask them to come to the table that members are aware of, and they have declined to come to the table. Now, I think that there is an opportunity to reach a consensus around this if this bill is allowed to move forward. If you kill this bill, there will be no negotiation. There will be no middle ground. We need to move the bill forward to get the parties to the table to allow us to negotiate around what is a very, very modest improvement that will allow underserved areas to actually have primary care physicians. Final note. There's some distinction being drawn here between hospitals and clinics. Let me remind you, hospitals have clinics too. In fact, we've done a lot of legislation in this House and in the other House to try to get hospitals to have more clinics so we get people out of ERs where it costs us a lot more to serve them and into clinics. And so this sort of mutual exclusivity that's being argued between these two things truly does not exist. But having said that, I think there's more room and opportunity, and all of the authors are willing to compromise if everyone's willing to come to the table. You kill this bill, that won't happen. I ask for your aye vote.
Mr. Smythe.
Thank you, Madam Speaker, and members. I rise in opposition to the measure, and as well as this bill being heard in Health Committee last year, it was also heard in B&P, of which I serve on. And in those discussions, the author and the committee was pretty clear about their desire not to take any other amendments to the bill and to move the bill as forward. And no surprise that we've come through and the bill has been amended substantially. I understand we're in the big leagues, and so you have to be prepared for that, and so the bill's here today. But make no mistake that this bill will not provide any new physicians to the state of California. And like several of the other speakers have said, it will simply shift from one area to another. And while there may be language in the bill that says that you cannot recruit or will not hire others that are currently employed from the other districts, well, what is that going to do to prevent a physician to, on their own, willingly say, I'm going to leave this area to move to another? Because if you recall, when the receiver took over of our prison system here in California, and started raising the cost and the price for doctors and nurses, what did you see? You saw an increase of physicians and medical staff go to those prisons at the expense of other underserved communities because of the increase in pay to them. So let's be clear. This will not add any new physicians. It will just shift them from one area to another. And if I may just read briefly, Madam Speaker.
Without objection.
Thank you. This bill will allow any health care district or general acute care hospital that is in a health professional shortage area. Well, nearly the entire state of California is defined as a health professional shortage area, including many parts of the Los Angeles areas like the city of Pasadena, which clearly is not a rural area. So when we vote on this, keep in mind this will not add any new physicians to the state of California, and I ask for a no vote.
Mr. Delatorre.
Thank you, Madam Speaker. I just wanted to make 2 points. One, a point of clarification from me. I'm not asking for the author, the jockey. This bill gets off this floor. It goes back to the Senate. There is no kumbaya moment. There is no discussion. It goes back on concurrence, up or down, period. So there is not going to be any negotiation. There's not going to be any coming to the table. This bill leaves this floor. It goes back there for an up or down vote. That's it. And secondly, I'll leave you with this pearl of wisdom. It is difficult to get a man to understand something when his job depends on not understanding it. That's from Upton Sinclair, and I think it's very appropriate in this moment. Thank you.
Mr. Adams.
Thank you very much, Madam Speaker. Being somewhat remiss in following Upton Sinclair, I'd rather proceed forward with my own words and suggest to you that there is a couple of points that I think are worthy of consideration as we go forward. Number one, and this is by way of reiteration, it is fundamental that you understand that it is disingenuous to suggest that good faith negotiations have not occurred. The stakeholders involved in this matter have worked diligently, not just for the last couple of months, but for years now, to try to craft an accord that makes this a workable piece of legislation. So to suggest that people are not coming forward in good faith and working is just flatly not true. And secondly, members, as somebody who's somewhat conflicted by virtue of the fact that I have both hospitals, both types of hospitals in my district, rural hospitals and non-rural alike, I can tell you that there are definitely needs that exist throughout the state that this bill seeks to address, but I do not believe that this vehicle is the way to get that done. At the end of the day, California has crafted a number of models that make it possible for physicians to be hired. The fact that the people who are the sponsor of this legislation don't want to proceed under one of those models is not to say that it's not possible. It's to say they just don't want to have to go about it the same way that we've seen others do successfully. Members, we have a mechanism in place for making sure that we have a clear, bright line delineation between the professionals that are our physicians and the professionals that are our hospital administrators. I would suggest to you that intermingling these is not necessarily the way to go. I would urge a no vote on this measure.
Ms. Hayashi.
Thank you, Madam Speaker and members. I rise in strong opposition to this measure for 2 reasons, and I don't want to talk a lot about the corporate practice of medicine issue because I think that's been covered adequately here. But let me just remind you that this law has been around for 100 years because it protects consumers and patient care. You do not want your physicians reporting to the hospital executives who have corporate profits in mind. So members, This is a very dangerous thing to do when we start amending corporate practice of medicine that's been around for over 100 years. I want to make a point about the stakeholder meetings, and I think a number of my colleagues have spoke to this issue. As chair of Business and Professions and Consumer Protection Committee, I could tell you that I also try to bring people together to craft a compromise and had many stakeholders, including the Hospital Association, come to my office to negotiate this bill. I've had the exact opposite experience from Mr. Jones, who was former chair of Health Committee. It was, in fact, the supporters of this measure who refused to come to the table, and CMA offered a number of amendments and compromises. And it was the supporters of this bill who did not want to compromise, who in fact made several threats against other colleagues of this House. So let's be clear about who has come to the table with good intentions to negotiate this bill. I believe that Mr. Chesborough had a bill that I supported in my committee that gives very limited pilot opportunities to see if this would work. This measure does not increase a single physician in underserved communities. In fact, it will hurt access to health care. And you'll hear a lot about how a lot of the communities in underserved areas, including rural areas, do not have access to health care. This bill does not address that issue. This bill amends the corporate practice of medicine, the most important law that we have in our state, protecting patient and physician. And so therefore, I have to oppose this bill based on two reasons, because it doesn't do anything to increase access to services in rural areas and underserved areas. The second point is this is just really outrageous that the proponents of this bill is accusing CMA leadership of not negotiating in good faith. In fact, they have been for the last year and a half. I respectfully urge your no vote.
Mr. Anderson.
I also rise in opposition. If you build a home with a sand foundation, it doesn't matter how strong or how well crafted that home is. It will never, ever stand for long. We have a definite problem. We all understand it. I represent rural San Diego, and this is an issue that's close to my heart. But the answer isn't building that house, building that foundation on sand. The answer is bringing more doctors online. And I appreciate the author and in his efforts to fix the problem, but the premise is wrong. The premise should be, how can we bring more doctors online, not steal doctors from one community to another community? I also agree with many of my colleagues from before. I don't support the national health care policy because I don't want an accountant making medical choices for me, no more than I want a hospital accountant making those same choices. I want to empower doctors to do what they do best and to heal people. And I want to give them all the flexibility without the pressures of costs to do the very best that they can do. This bill undermines that, and for those reasons, I can't support it. But there is a real issue that we do have underserved areas, and we need to fix that. And I think the best way is to come from a completely different angle and look at opening more medical schools, bringing more doctors online, and actually addressing the problem from a solid foundation, not build on top of sand. I urge a no vote.
Seeing no further questions or debate, Mr. Swanson, you may close.
Yes, thank you very much, Madam Speaker. Let me address a couple of issues that have been raised. First of all, we are talking about healthcare districts, which are not corporations. And to my distinguished colleague, Mr. Arambula's statement, which I agreed with much of it, this particular bill is a pilot. And the pilot would sunset in January 1, 2018. So I'd hope that makes a difference to him. Let me, Madam Speaker.
Little order, members.
The issue of the whether or not this matter will result in additional negotiations Of course it will. And I think everyone in this chamber knows that's a fact. That's the reason we're considering it. Everyone, each of our policy committees, including the Speaker of this great House, has had discussions bringing people to the table. And so this bill moving forward will certainly allow an opportunity for us to have further discussion. Let me deal with a couple of the myths. The issue dealing with corporate practice of medicine. Under current law, the corporate ban does not apply to nonprofits. So nonprofits hire their physicians. Where is the evidence that these physicians have been directed on how to treat their patients? For now 2 years, I've asked for the evidence. Where is it? Under current law, licensed charitable institutions, medical universities, private or public, they can hire physicians. Don't just stand on the floor and say that the corporate practice of medicine is being challenged, and if you allow for these institutions, or in this case, healthcare districts, to have the same right that these institutions have now, that some kind of way the sky is going to fall in. Where is your evidence? You didn't hear it because it doesn't exist, because it's not a problem, because physicians have integrity too. Physicians that take care of us take their responsibility seriously, and they're not going to be manipulated. There is no evidence to back that up. And so, what are we talking about here? We are talking about the fact that there are mothers in the state of California with children with medical problems that have to drive 90 miles before they can get help. That's okay with some of you? It should not be. We all admit that the medically underserved areas are facing a shortage of physicians. So what are you going to do about it? Are we going to stand here, have our feet firmly planted in concrete? Or are we going to stand up for the principles of accessible health care? And California, on the cutting edge, are we going to be last to prepare for the 5 million people that are going to have insurance, that need accessible to care? Or are we going to wait until more people have to drive 90 miles, 180 miles to get help? So let's not act as if we don't have a responsibility to act now as the nation moves in the direction of accessible health care. Does this bill go as far as I would like it to go? No. But I understand the legislative process. And so this bill requires your careful consideration. And I believe that the parents of the children of this state that are in need of health care should have an opportunity, and this bill provides some relief, and I ask for your aye vote.
Clerk will open the roll. All members vote who desire to vote. 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 Mr. Swanson moves the call. Okay, members, our last bill today on the daily file, item 21, SB 769. Clerk will read on the amendments.
Senate Bill 769 with amendments by Assemblymember Monning.
Mr. Monning.
I need to pass on that for 1 minute, if you would.
Pass temporarily. Members, pursuant to Assembly Rule 77.2, I am re-referring AB 46, Monning, to the Elections and Redistricting Committee. We're going to file item 58, SB 1253. Clerk will read.
Senate Bill 1253 by Senator Strickland, an act relating to probation.
Mr. Portantino.
Thank you, Madam Speaker and members. SB 1253 would prohibit a child molester from being placed or residing for the duration of the probation term within 1/2 mile of the child victim's residence. Current law imposes residency restrictions on serious and violent parolees, including sex offenders. A child victim deserves this type of protection regardless of whether the offender is convicted of a misdemeanor or a felony. These children have suffered unimaginable harm and should not be further traumatized by being forced to live near their attacker. They deserve to feel safe in their own neighborhood and not have their attacker living just around the corner, and I respectfully ask for an aye vote.
Seeing no further questions or debate, clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll, tally the votes. Aye 61, no 0. Measure passes. File item 51, SJR 24. Clerk will read.
Senate Joint Resolution 24 by Senator Yee relative to violence against women.
Mr. Gilmore. Members, if you could please sit down in front of Mr. Gilmore. Members, Dr. Anderson. Dr. Anderson.
Thank you, Madam Speaker. Members, SJR 24 is about international violence against women. It is now estimated that out of every 3 women globally is a victim of violence, domestic violence, trafficking, and forced sex, among other forms. This is an extremely interesting point here. It is also estimated that more women have been killed by everyday violence than men have been killed in world wars. In addition to the negative effects on women's emotional and physical health, violence against women is a major cause of poverty. Violence keeps women from getting an education, keeps them out of the workforce, and decreases their ability to earn the income they need to lift themselves and their families out of poverty. It is proven that women's health, education, and economic opportunities directly impacts the development and well-being of their children and their communities. Greater gender equality leads to improved nutrition, lower child mortality, less government corruption, higher productivity, and reduced HIV infection rates overall. Violence against women is preventable. There are proven solutions that work. Increased access to economic opportunities is crucial to the prevention of and response to domestic and sexual violence. And lastly, members, research shows that giving women in poor countries economic opportunities empowers them to escape abusive situations. Campaigns to change social norms have been shown to change attitudes that condone and tolerate violence against women and girls and reduce violence and abuse. This resolution urges Congress to pass the International Violence Against Women Act. The International Violence Against Women Act would, for the first time, incorporate these solutions into all U.S. foreign assistance policies. I ask for your aye vote.
Mr. Gilmore, do you want to ask for co-authors on this item?
Yes, please, Madam Speaker.
Mr. Gilmore is asking for the first roll call to be open for co-authors. Members, co-authors, clerk will call the roll. We'll open the roll. All members vote who desire to vote. All members vote who desire to vote. Clerk will note that there are 47 co-authors on this item. This is an SJR, so it does require a roll call vote. Clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll, tally the votes. Ayes 49, noes 1. Measure passes. Members, we are at the second day consent calendar. Does any member wish to remove an item from the second day consent calendar? Seeing and hearing none, the clerk will read.
Assembly concur Resolution 97 by Assembly Member Ng relative to Make a Difference Day.
Clerk will open the roll on the consent calendar. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll, tally the votes. Ayes 68, no 0. On the consent calendar is adopted.
And Assembly concur Resolution 99.
Ayes 68, no 0. Okay, members, we got a number of items on call. The first item is a procedural motion to suspend Joint Rule 62A. Clerk will post. Mr. Calderon requests an aye vote. Mr. Hagman requires a no vote. Requests a no vote. Clerk will close the roll, tally the votes. Ayes 44, noes 27. Motion passes. Okay. The second item is to suspend the joint rules. Clerk will post. This requires 54 votes. Mr. Calderon and Mr. Hagman request an aye vote. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll, tally the votes. Ayes 64, noes 2. Motion passes. We're going to go to ACR 171 by Mr. Gaines. Clerk will read.
Assembly concur Resolution 171 by Assemblymember Gaines relative to Yellow Ribbon Week.
Mr. Gaines.
Great. Thank you, Madam Chair and members. If I could have your attention, please. Thank you for the opportunity to bring up ACR 171, Yellow Ribbon Week, which is coming up June 28th through July 4th. And Yellow Ribbon America was founded in February of 2003 as a nonpartisan national grassroots effort to unite all Americans to directly help our nation's military members and their families. Their approach is simple: to help businesses, residents, churches, and community groups focus their resources on helping military members and their families in their individual communities. When soldiers are activated and then deployed, their principal concern is for their families' morale and well-being. The Yellow Ribbon America campaign was organized by many communities to provide our military and their families real help and support. Yellow Ribbon America provides the national framework to organize America's cities and towns, delivering immediate and direct support to America's deployed and returning military personnel and their families. According to Yellow Ribbon America, as of January 12, 2010, there were 143,236 National Guard and Reserve personnel mobilized. I've got a personal friend of mine who's a Brigadier General, Don Courier, who's in Baghdad, and my wife grew up with him, went to high school with him. I've known him personally for about 15 years, and over the course of that 15-year time frame, he's been activated for 7 of the 15 years. And so when we take a look at how men and women across this nation are stepping up to serve our nation and the impact that it's having on their families, I think it's critical that we recognize them. So I urge an aye vote. Thank you.
Mr. Gaines, would you like co-authors on this measure?
And we'd love co-authors. Thank you.
Mr. Gaines is asking that the first roll be open for co-authors. The clerk will open the roll. This is for co-authors, members. Clerk will note that there are 64 co-authors. This is an ACR, so we can take a voice vote on this item. All those in favor say aye. All those opposed say nay. The ayes have it. The measure is adopted. We'd like to welcome some guests in the gallery. There are 2 fourth-grade classes from Carroll Elementary School. The teachers are Mr. Jeff Stultz and Mrs. June Miller in the gallery. These are constituents of Miss Huber. Welcome. Mr. Logue, are you ready with your request to adjourn in memory?
Yes, thank you, Madam Speaker. I adjourn in memory of Mayor Abourezki in honor of his life of Raymond Abourezki, former Marysville councilman and mayor and lifelong Yuba Sutter resident. We know him as a straightforward public official who had vision and always wanted what was best for Marysville. He operated under that credo, and as a result, he left my district a wonderful legacy. Abourezki ran for the city council in '86 under a campaign of bringing new, younger voices to city leadership. He became mayor toward the end of his 4-year term on the council. After he left office, Abourezki continued to weigh in on city politics. 20-year veteran of the United States Air Force, Abourezki opened and ran the cobbler shop in Marysville for 30 years after he left the service. He was also a member of the Elks Lodge, Marysville Exchange Club, Veterans of Foreign Wars, Disabled American Veterans. He will be missed by especially his wife, his 3 sons, 2 daughters, a sister, and several children and grandchildren who love him so much. Thank you, Madam Speaker.
Thank you, members. Please bring the names to the desk to be printed in the journal. The Appropriations Committee will be meeting upon adjournment of session in the Rules Committee room. Appropriations will be meeting upon adjournment in the Rules Committee room. We'd also like to welcome additional guests in the gallery, Ms. Linda Ackerman, National Committee Chairwoman and members of the California Women's Leadership Association. Welcome. Members, pursuant to Assembly Rule 77.2, I am re-referring AB 1152 by Mr. Anderson to the Governmental Organization Committee. Members, we're waiting to lift the call on one last item. Members, the session schedule is as follows. Friday, June 18th, no floor session, no check-in session. Monday, June 21st, floor session at 12 noon. Members, we have one last item on call, file item 19, SB 726. Clerk will post. All members vote who desire to vote. 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 Mr. Swanson moves the call. Okay, members, we're going to lift the call on file item 19, SB 726. Clerk will post. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll, tally the votes. Ayes 38, noes 26. Measure fails. Mr. Swanson notices reconsideration. This concludes the business on the daily file in the regular session. All other items remaining will be passed and retained. All motions shall be continued. I'm ready to entertain a motion to adjourn. Mr. Calderon moves. Mr. Hagman seconds. That this House stands adjourned until Monday, June 21st at 12 noon. Quorum call is lifted.